Have you ever wondered why you do what you do in healthcare? Have you ever wondered whether your job makes a difference? Have you ever wondered, even though you don't touch patients, if it really is important? I want to tell you a story from my past, from almost 30 years ago, that helped me understand the importance of everyone's role in the healthcare environment. So it was November of 1987. I was a new faculty member at the University of Louisville. In November of that year, I got a phone call from my mother who told me that my brother, who had chronic hepatitis C infection, it's a liver infection, had suddenly gone into coma and been admitted to a hospital just outside New Orleans. He was in bad shape, based on my mom's description. By the time I got there, he was in critical condition. In looking at him and reviewing his record, it was clear, talking with his doctors, that he was not going to make it. I arranged for him to be transferred to a transplant center at Tulane Medical Center. And he was evaluated there, and essentially they confirmed that without a liver transplant, within the next several days, he would likely die. We were fortunate, though, that a hospital in New Orleans had just started doing transplants just the month before and asked us if we wanted to have the transplant surgeon come and talk to the family about the possibility of him getting a transplant. And so he came, evaluated my brother, and talked with us and said that they could put him on the transplant list. They'd be happy to transfer him to their hospital, and we could see what would happen. So we decided to do that. That was on a Tuesday when he went to that hospital. And that very night, we got a phone call about 11 o'clock at night that a donor liver was available. We got to the hospital, and sitting in the waiting room, I remember this as though it was yesterday, there was another family in the waiting room. It was a family of the patient that was going to get the same donor's heart. The transplant started about 1 o'clock in the morning. I noticed as I was sitting in the waiting room, surgeons running across a hallway carrying a red igloo cooler. I knew what was in that cooler. It was my brother's new liver. And that team of people in the middle of the night was going to have to come together to get that put in the right way to save him. The transplant lasted for 12 hours, 30-something units of blood later. He finally came out of the operating room mid-Wednesday afternoon, was put in the ICU. The following morning was a Thursday morning, and he woke up for the first time in a week. The liver was working. It had done what it needed to do. That morning, Thursday morning in November of '87, was Thanksgiving Day. And Thanksgiving's really never been the same for us since. He survived for 7 years after that transplant. He lived to see 2 sons get married and grandchildren be born. And we were so fortunate that that transplant program was available there in New Orleans, because he was too sick at the point that we found him initially for him to get transported to another transplant center. I tell you this story because I want you to know that had there not been finance people who set up the transplant program and administrators who coordinated getting the accreditation for the program, if there had not been nurses who got special training, doctors who had special training, IT people who set up the infrastructure underneath it, operating rooms that were available, had all that not been done, my brother would have died that week. And it helped me to realize just how important all of our roles are. All of our roles. So whether you're a nurse or a medical assistant, whether you're a finance person, an accountant, an IT tech, whatever you do for University of Louisville Physicians, know that your job is important. It makes a difference. We all have a role to play, and that role is critical. There's no other job like a job in healthcare. Thank you for being part of UofL Physicians.